Hello everyone. Today we are going to give you tips on how to bulletproof your body in 2022. We are 4 sports physical therapists at Physical Therapy San Pedro. I'm Dr. Janae Brown.
I'm Dr. Marley Bay-Hawkins,
Kristen, and Dr. Pete.
And we are here again to talk to you about how to give you tips to bulletproof your body. So, I was not the writer of this blog. Dr. Bay wrote this blog, so I'm going to have her give you all her inspirational reasoning upon why she wanted to talk to you guys about this early in the year. But we do know that 2022 was a rough start for a lot of people. Anytime we hit a new year, we have goals, we have things we want to do, hit PRs, we want to run a marathon, we want to make a new team, we want to just get back to the gym and work out, get back on our goals, right? But I think this year stunted some people with getting sick with the new COVID variant, and if you didn't get sick, maybe you just haven't been able to stay on your goals. So we want to check in with how you're doing with these things and give you guys some do's and some don'ts and ways to bulletproof your body. So Dr. Bay, the floor is yours. Share with me your inspiration, or us, your inspiration, on why you wanted to write this blog.
I thank you, Dr. Brown. Well, I think us as PTs, we notice a certain trend that happens every year.
Mm-hmm.
We, luckily our staff, we're all pretty consistent about staying active, but the trend we see is come January, maybe not the first week, but for sure that second week, this year a little later because of unforeseen circumstances, the gyms start to fill, your classes get packed, more people are out on the boardwalk.
Yeah.
People are ramping it up.
Yep. Goals.
What happens when we ramp it up too fast? Injuries. That's what we don't want to see.
Yeah.
We don't like it when you guys can't reach your goals because you have unforeseen injuries or pain starting to develop, stiffness starting to develop. So the purpose of this blog is to hopefully teach you the do's and don'ts so we can break this cycle.
Yeah, absolutely. Awesome. So we're going to have Dr. P start with our don'ts.
We
have been debating on how we want to start. So
not to be a negative Nancy.
Yeah.
But we have a list of don'ts because we see patients come in. I mean, you have to remember, we're in the business of injury, as Dr. Brown says. So we see people come in and they give us their complaints. This is what happened. This is why I'm here. And there is a trend, like Dr. Bay said. So we just want to bring some light and hopefully save you guys from injury this year so that you can continue reaching your goals. So there's 3 things, I guess we can call it like the over syndrome, right? We don't want to do these 3 things. We don't want to overtrain, overload your body, and we don't want to overstretch. Those are the 3 main things that we see people coming in here for injury. Okay, so the overtraining is just going ham, going 7 days a week, no rest, no recovery, right? Doing 3 spin classes a day. People say they do. Riding that Peloton because you got really excited, and it's like 45-minute classes 7 days a week, right? So that's a little bit of overtraining.
Yeah. Especially coming off and maybe doing nothing, right?
Yeah.
You're like,
so
do nothing
from
in the
0 to 100,
yeah.
right?
Yeah.
So that's a risk for injury. Overloading or underloading your body. Overloading is usually what we see.
Yes.
You start to compare yourself to your 20-year-old self when you used to lift X amount of weight or do this many classes per week, and you want to just compare and be to where you used to be.
Yeah.
So sometimes your body isn't ready for those loads, and you sprain, you strain, you pull muscle because you're overloading.
Yeah.
And then overstretching. So some people just really want to stretch their pain away, or just they think that stretching is the only thing to make your body mobile, or feel good, right? Or you have a pain, you just want to stretch it away.
Yeah.
So that is usually not the right answer.
Yeah.
And so those 3 things are some of the main, like I said, the main causes that we have people come in for injury. So try not to overtrain, overload, overstretch.
Yep. Well done, Dr. P. Dr. Bay, give us some do's. What are some things that we want people to do and that we think will be healthy for them to do to bulletproof their body in 2022?
Definitely. The main do's are do a good warm-up. Do progress slowly. Do cross-train. Do rest, and do recover.
Yep, absolutely.
As always, you'll hear me in the clinic telling people I work with all the time, make good decisions. So listen to these to try to guide yourself in some good decision making for your body, okay? So when we talk about the warm-up, we're gonna wanna target engaging our core, making sure we do some isolated motions, fit in some dynamic stretching and ranging our joints. Those are big areas to hit, okay? Slow progressions. Just because you did something one time successfully doesn't mean you should progress the next time, okay? That's a big area people get into trouble.
Absolutely.
You want to try something several times at a certain load before we move to the next one to make sure your body has the time to adapt, okay? Cross training. This is a hard one. Just because your sport is running or dancing and you do a lot of that doesn't mean you have the strength or the flexibility to actually do it well or keep progressing to your goals. So we recommend fitting in 1 or 2 days a week on top of your specific sport training to work on the flexibility and strength that that sport requires.
Yep.
Last, maybe the funnest ones, rest and recovery. So I know this is hard, especially so many of us are busy and have big goals. We need at least 1 full day of rest, okay? I didn't say couch potato, okay?
Yeah.
Think about
Sometimes.
day at the beach, nature walk. We want to keep light activity because I don't know about you, but my body really stiffens up when I don't move at all.
Yeah.
So that is not what I'm saying.
Yeah.
Just keep it light, keep it fun, give your brain a break from training, rest, okay?
Yeah.
And then recovery. This could be kind of fun self-care things.
Yeah.
Do you want to do an Epsom salt bath, a cryo session, a sauna session, even just use of an ice pack where you anticipate soreness can really go a long way into improving the body's ability to bounce back.
Yeah, for sure.
So those are the do's.
Yeah, for sure. Whatever feels good. I always tell people over recovery and rest, recovery, whatever feels good. If acupuncture feels great,
That's
awesome.
like another great one.
Chiro feels good, do it. Like what makes you feel good, that's your recovery, right? Everybody's different, we all respond differently, right? Okay, so we went over some don'ts, some do's. Kristen is gonna take us through things you need to check in on, along that journey. So what are some check-ins? What are some things that our amazing listeners should be checking in with?
So maybe things are going well, maybe you're not feeling your injuries as much, so then you don't pay as much attention to maintenance and taking care of your body. So sometimes you just need to check in with certain things just to make sure everything is operating optimally.
Yeah.
So these things would be tightness, mobility, and then your balance and coordination. So tightness, if you feel tightness, it usually means an injury is coming on, and usually when you increase your activity levels, you're gonna feel that. So tight hamstrings are very common, and then if you don't address that, it can just lead into other things like tight low back injuries, hip pain, and everything else surrounding. Mobility, it's important to just make sure that you have the range of motion in the joints that you're gonna be working that day. Just if you skip over that, maybe you find that you didn't have the range that day, and then you didn't catch an injury that you could have prevented that.
Yeah, absolutely.
So something we do here is like a dynamic walking warm up before you get started, and that just kind of incorporates balance, mobility, and flexibility before you get started, and gives you a chance to kind of catch things first.
Yep, absolutely.
And then balance and coordination. Sometimes we get stuck looking at the end result, like how fast we can run or how high we can jump, and we forget to just check in on our stability to see if we can even stand in one place in a stable manner, much less move around and jump with it. So check-ins are important just to catch an injury before it happens.
Yeah, absolutely. And for us, like, our goal is, again, we're injury specialists, so we want you to feel good in your workouts, feel good in your